Hi, this is Esmail Fadel from University of Aden, Faculty of Medicine and Health Sciences. Actually, today we will continue our lessons about ECG interpretation. Today we can speak about the 12 leads of ECG and how we can interpret them and look into the heart from different directions. What does that mean? Actually, the heart is an object in the middle of your chest, somewhat to the left more than to the right, but actually you are looking to the heart from anterior, lateral and inferior and so on. Horizontally and vertically, all these leads we can interpret them very precisely. But before we are going on this, actually I think as a student, in the second year, actually what this means. Actually, this is, telling us the electricity of the heart. This is a P wave for the depolarization of the atrium, and this is a QRS complex, which is, telling us the depolarization of the ventricles, and this is T wave for repolarization of the ventricles. Okay, this is the only things that we know about ECG in the second year. But actually, when you go to the practice and see the ECG, in reality, actually, it's not like this. It's not just one lead. It's not just one. No, there is a 12 leads. Yes, 1, 2, 3, AVR, AVL, AVF, and from V1 to V6. This is a very, very hard. You said only we know one. What does that mean, all these leads? Actually, this is what we are going to tell you in this lesson. So be careful and listen to us very well, okay? So let's start. Actually, as I told you, we have 12 lead of the ECG, okay? So the 12th lead ECG sees the heart from 12 different views. Yes, we will see as soon as possible what does that mean. Okay, therefore the 12th lead of ECG help you what? To see what is happening in different portion of the heart. Yes, all these leads actually are viewing the heart from different directions, but actually they occur at the same time from different directions. Actually, as you are seeing an object by 12 persons from 3 different directions, and everyone at the same time telling you what he's seeing at the same time. As let's for example say this is any person and this is another person, this another person. All of them, they are seeing the heart from different views. This is from the front, this is from the lateral, this is from behind, this is from inferior. All of them, they are seeing the heart by their eyes. Just imagine this, and every one of them is telling you what he is seeing. If there is any problem, he will tell you there is a problem. Maybe sometimes, L1 maybe see a problem, but L3 is not seeing it. So L1 is what? Is making abnormality on their electricity, but L3 has no abnormality. This is what we mean by this. And the rhythm strap is only one of these 12 views. Actually, we will tell you what we mean by the strap in later on this video, okay? Yes. So the 12 leads, actually we divide them into actually 2 groups. The first group called pericardial leads. There are 6 pericardial leads, and other 6 we call them limb leads. The 6 limb leads, actually we divide them further to 2 portions, which is augmented limb leads, and sometimes we call them as a unipolar limb leads. And also we have another group from the limb leads, which are, we call them as a standard limb leads, yes, and also we call them as a bipolar limb lead, and we will tell you why we call them as this, okay? So please listen well and look very well on these 12 leads. The 12 leads, what? Including the 3 limb leads, yes, we call them as a standard limb leads, which is L1, L2, and L3. Yes, this is L1 and this is L2 and this is L3 for this direction. From the right to the left, this is the direction of the L1, okay? And this is the direction of the L2 from the right arm to the actually left leg, okay? And the L3 is from the left arm to the left leg, okay? This is the direction, as you see here, And these red arrows, telling us the direction of these, standard lamp leads. What does that mean? Yes, this is very, very important. As I told you, the standard lamp leads is obtained the, graph of electrical forces as recorded between two lamps at a time. That means for the L1 is actually, obtaining the electricity from the right arm and also the left arm at the same time. So there must be two lamps to obtain the electricity between them. And so on and so forth for L2 and 3. Okay? And also we have a 3 augmented lamp leads. Yes, they are AVR, AVL, and AVF. So actually the augmented lamp leads that obtain the graph of electrical forces as what? As recorded from one lamp at a time, not from two lamps. Okay? But this is very, very important. So sometimes because of that we call them as a unipolar lead. Okay? Yes, very important to know this. For this, this is augmented lamp lead, AVR, and this is AVL, and this is AVF. The center is, it is the another portion. We are not, taking it from two lamps. No, from the center to the lamp, so we call them as a unipolar, no bipolar, because only from the center to one lamp, not two lamps, okay? So the center is considered as a 0 for these augmented lamp leads, okay? Yes, and this is the direction of these leads. Yes. You have to remember, because of the lead, one is looking to the lateral side. Okay, very well, look here. So the L1 is telling us the lateral portion of the heart. Yes. And also AVL, because it goes to in this direction. Yes, AVL from the center to the left arm. So it's telling us about the left side of the heart also. And so on and so forth for the other leads. You have to remember this. So AVR, as you see in the picture, AVF and L2 and L3 are what? Looking at the heart from the inferior portion. But AVR, yes, is looking at the heart from the right portion. You have to remember this. Okay, and also we have something called pericardial leads. There are 6 from V1 to V6. You have to remember them very well. Okay, this is an heart, yes, as it normally, stay on your chest. So we have some leads, get a good view of the heart. Yes, we have an anterior portion. Yes, you can see this is the anterior portion of the heart. And also we have the inferior portion of the heart. This is the inferior portion of the heart, okay? And this is actually the lateral portion of the heart, yes, as some leads can see to this portion. Okay, so here we have to speak a little bit about the ST elevation. One way to diagnose an acute myocardial infarction is to look for what? For the elevation of ST segment. Here in this example we can tell you, if the infarction occur in the inferior portion or the anterior portion or in the lateral portion of the heart. Yes, very, very important to know this, okay? And as you see very well here, this is the ST. If you see this ST is elevated from more than one lead above more than one small square, this is a very, very important sign for myocardial infarction, okay? For example, here you can see very, very well an ST elevation. Can you see it here very well? Can you tell me where? Just stop the video for a while and tell me. Yes, you are right. Yes, you can see here elevation of the ST is greater than 1 and more than one small box. Yes, in 2 leads or more. Yes, it's very important for the diagnosis of myocardial infarction. Here you can see it. Yes, in V2, V3, also V4. You can see it. V5. There is some elevation here, and also V6. Very important. Okay. Okay, we can see, as we told you, the heart from a different views, from a different direction by our leads at the same time. Okay, the same electricity from different views. For example, if you see here the pericardial leads, yes, I will give you a video how you can put the leads on the body, so you can obtain the information very well by this video. I think you will enjoy it.
To obtain the ECG graph, electrodes have to be placed on standard positions over the limbs and the chest. 4 electrodes are placed on the limbs, 1 each on both ankles and 1 each on both wrists. 6 chest electrodes are placed over the precordium on standard positions. The limb electrodes are secured in place by means of clamps, while the chest electrodes are secured in place by means of rubber bulbs. Each clamp has a flat metallic plate which maintains skin contact while the electrode is fixed here. Each rubber bulb is attached to a cup-shaped metallic plate and the electrode is fixed here. The patient cable consists of 10 leads, each lead carrying an electrode at its tip. Accordingly, there are 4 limb electrodes and 6 chest electrodes. Each limb electrode is color-coded and marked. For instance, black for right leg, green for left leg, red for right arm and yellow for left arm. Accordingly, the chest electrodes are also color-coded and marked V1 to V6 for different positions over the precordium. A single lead from the junction box connects all the 10 electrodes to the socket in the ECG machine. The part to which the electrode has to be placed is first smeared with ECG jelly. This maintains good electrical contact between the skin and the recording electrode. The patient is now ready for his ECG. The 4 limb electrodes and the 6 chest electrodes are in position.
Okay, as we see the video before, now let's go back to our lesson again. As I told you, we have 2 types of leads. We have a limb leads and pericardial leads. As you see here in this picture, actually we have a pericardial leads from V1 to V6 looking to the heart from horizontal plane in different directions, anterior and also lateral wall in horizontal plane. Okay, yes, if you look here, the anterior portion of the heart is best viewed by using from V1 to V4. But in another box they said what? They said V1 and V2 are looking to the septal of the heart, and V3 and V4 looking to the anterior wall, and from V1 to the V4 actually looking for the anterior septal, and from V3 to V6 is anterior lateral. Okay, this is very important information for very exact portion of the heart. Okay, yes, you know, to look to the anterior myocardium function is very good to look from V1 to V4 in general. Okay, I think this is more accurate because you cannot say very exactly where the infarct, because as you know, the people who do the ECG sometimes is not very good for putting it in the correct place. Okay, so here I will give you a test, okay, to test you for a myocardium function for ST elevation. Do you see any ST elevation in this picture? If you see, please tell me where. Yes, please stop the video for a while and tell me. Yes, you are right. The person is having an acute anterior wall myocardial infarction. Yes, anterior means from V1 to V4. Okay, you have to see an ST elevation in more than 1 lead. 1 lead, it's not a diagnostic, must be more than 1 lead. Okay, so here is very clearly seen in the V1 and also V2. Okay, and also V2, sorry, V1 and V2 is having what we call them as an ST elevation, and a little bit on the V3, but it's not very well, okay, clear. So you have to know this, and you have to be very careful where you can find the ST elevation to put it in the correct position. So you have to look to the ECG very well to tell the correct position of the myocardial infarction. So this is a picture of the heart, and here other location where we can find the myocardial infarction. The last example talking about the anterior myocardial infarction, okay, where we can see it from V1 to V4. Any lead of this is telling us anterior myocardial infarction, but also there is another portions of the heart can be seen by the ECG paper. The lateral portion of the heart, this is the lateral. What is the leads that we can see the infarct by it? Actually, I will tell you. And also we have inferior portion of the heart. Also, there is a lead responsible for this portion to see the myocardial infarct. Okay, so here again we have a picture for limb leads. Okay, and we have augmented limb leads. Okay, and we have a pericardial leads. Okay, so I told you about the pericardial leads from V1 to V4 looking to the anterior wall. From 5 and 6 is looking to the lateral wall of the heart. But actually the lateral wall of the heart is not just V5 and V6. Also AVL, as you look to the arrow, is also looking to the lateral side of the heart. And also, yes, you're right, L1 is also looking to the lateral side of the heart. But what about the right side of the heart? Only we have one lead, which is AVR. Okay? Only the AVR is looking to the right side of the heart. Actually, the inferior myocardial infarction can be seen by what we call it at what? As L1, L3, and AVF. 2 leads from the limb leads, standard limb leads, and also 1 from the augmented limb leads can tell us about the inferior myocardial infarction. So you have to look very well on the ECG paper to tell us where is the myocardial infarction. Actually, on the ECG paper, the AVR is actually different from all these leads, and we can see it is opposite them. Okay, every wave on it is opposite because it goes opposite of the electrical current of the heart. Is the only one which goes what in different direction of the electricity. As we know, the SA node is here and goes down to here. Okay, but this lead is going opposite this electric current, so it appears different on the ECG machine. So remember, the anterior portion of the heart is pissed fuse from V1 to V4. Okay, this is the leads which look for the anterior wall. So what lead do you think the lateral portion of the heart is pissed fused? As we told you, is lead 1 and AVL and 5 and 6. Yes, this is 1, this is AVL, and this is 5 and 6 to look for the lateral portion of the heart. Now, how about the inferior portion of the heart? As I told you before, is lead 2, 3, and AVF. This is 2, 3, and also AVF. Okay, here what we have is what? Is a test for it. Now, where do you think this person is having a myocardial infarction? Just stop the video and tell me. Yes, you are right. Inferior myocardial infarction. How did you know? Just let's interpret this. Okay, this is an inferior myocardial infarction. Look to the ST elevation on the limb leads, on the 2 here, and also 3, and also AVF. All the other limb leads is what? Is normal. There is no elevation, just here AVF and 3 and also 2. Yes, that's right. There is a myocardial infarction on the inferior wall of the heart. You are very good actually. Okay, so what about now? Just stop the video for a while and tell me where is the myocardial infarction. Okay, yes, you are right. It is anterior lateral. How did you know this? Let's go and interpret the ECG again. The person is having myocardium involving both the anterior wall, which is this one. We have the anterior wall looking for the V2 and V3. Yes, and also V4. So this is what? Anterior. Also we have an elevation on the V5 and V6, so it's lateral. So what I can say, anterior or lateral? Okay, let's say it's anterior lateral. Also we have L1 and also AVL. So these two also, they are looking to the lateral side of the heart. So it's anterior lateral myocardial infarction. Actually, you are a good student now, and you can read myocardial infarction
very well and very confident. Okay, thank you very much for seeing me on the YouTube, and I will give you a lot of videos, and I will promise you that I will do my best to give you more and more videos about ECG interpretation. Thank you very much, and see you again in other videos. Goodbye.